Doctors of Reddit, what's the stupidest thing you've had a patient come in for? Had a patient come into the ER with very mild abdominal pain. I asked when it started and he said right now. He didn't have a coherent answer when I asked how he knew to come to the ER if his pain just started now. I still don't understand what brought him in. It was an all around odd encounter and he left pretty quickly. We didn't do anything for him. On a side note, he complained about the wait. He waited 12 minutes after he checked in before I saw him. I checked the records. I'm not exaggerating. Literally 12 minutes. 45-year-old male seen in the ER reported severe burns from boiling water all over his body. On exam he had no visible burns and had reduced his complaints to a small area on his right index finger. Again with zero visible damage. He asked me for hydrocodone several times. It was one of the most obvious drug-seeking behaviors I've seen. Emergency surgeon here. Got called to a.m. because a patient demanded to see me because her daughter's farts smelled too bad. Kept a straight face. Does calling M so you can get a ride to the hospital to see your other homeless friend who is in there count? I am not kidding, this person said she had a syncopal episode, then as soon as she got to the hospital, hopped off the stretcher and said she was fine after the doctor talked to her and went to another room. There was a guy who came to the ER because his iPhone app told him his sleep was poor quality. It was 3 AM and I'd been on duty in the emergency since 8 AM. I was exhausted. A well-dressed man came in with his 8-year-old, healthy looking son. I asked him what was the problem. He said, well, I was at a wedding and it occurred to me that my son is a little short. Can you give him something right now to make him taller? You went and brought out a stool, I hope. Whilst working as a GP, primary care physician, I had a 40-ish-year-old man come in with his wife complaining of electric shocks for the past year. It quickly became apparent these were static shocks caused by his cheap work suit and rubber-soled work shoes. I explained he just needed to change his shoes and it would stop. But both him and his wife were baffled. They'd never heard of static shocks and couldn't understand why I couldn't treat his condition. I work in a burn unit. Had another hospital fly. Yes, fly as in $50. 000 helicopter ride a patient over. Patient ended up having what looked like a bad tan on a small portion of their body. There were a couple little blisters on their leg. And they wouldn't stop screaming for pain medication and claiming that they were in 12/10 pain. Fairly sure that sending ER was just trying to dump them on us. Edit. Everyone can stop telling me how super serious and special their sunburns were. You still don't need a helicopter. Paramedic here. Had someone come into the ER because they were gay. The stupidest thing I've been to the doctor for. I took my young son in because he had a very regular rash on his lower back. It wasn't until I was in the doctor's office that I noticed that it had exactly the same pattern as the inlet cover on our jacuzzi, which he had just been bathing in. Not a doctor. Dated one who told me she had a patient who came in with his wife that every time they had sex, his mouth went numb for a little bit. It confused the hell out of her, so she had them both walk through their routine. It seems his wife was using a spermicidal film just before they started every time and he was going down on her. My mom took me to the ER once because she thought I had blood poisoning, which is a totally serious condition. What I actually had was fruit punch earlier in the day, and it dripped down my leg. The nurse wiped it off, and I was saved. Edit. I was 3. My mom was worried. Chill the FCK out. This is the stupidest reason to see a doctor thread. I know it was stupid. That's why I shared the story. Not a doctor but worked in an ER for several years. There was certainly a bit of cynicism that is probably prevalent in many similar settings. We'd get people bringing their kids in for hangnail or split ends on their hair. No. Seriously. The inverse, however, was that sometimes you could not be too cynical as it could have been a big deal in the end. I remember one time a Haitian family came in and most of the staff would roll their eyes when Haitians came in because their English was typically terrible and they would not be able to convey what was wrong. In most cases it was something like baby has sniffles or constipation, not really emergencies. This particular family brought a teen who claimed his eye hurt. Between the language barrier and the complaint, most people just shrugged and said, yeah, okay, whatever. Turns out the kid got a CT scan that showed worms basically eating his brain. I don't remember the outcome, but the doctors guessed it was poorly cooked pork. To be honest, not sure if the kid even lived or not. Oh my f***ing god. Oh my god. ER nurse here. I have a million of these. This is my favorite in recent history. A woman checked her 9-year-old son into the ER because he was upset he didn't win an award during an academic award ceremony at school. She wanted someone to talk to him or something. I can't deal with him. She basically wanted us to parent her child for her because she didn't want to be bothered. Not a doctor. Was a medical assistant. Not the most stupid thing ever, but we had several women come in to get tested for a UTI because they were peeing blood. Some of the first questions we ask are you feeling any pain during urination and have you recently had beets? 9/10 these women didn't have a UTI and remembered eating beets. So sometimes eating beets will turn your pee and or poo red, but it's not the color of blood. I also knew a lot of pharmacy students and they were also told to ask the patients to demonstrate how they were applying or taking medication if the patient said it wasn't working. The anecdote in their textbook was about a teenager who became pregnant even though she insisted she used contraceptive jelly. She was spreading it on her toast. And that reminds me of another time. This woman came in and said the syringe for her baby's liquid medicine wasn't working, so we asked her to demonstrate what she was doing for us. She sticks it in the bottle, turns it upside down, and says, see? Nothing. You have to pull the plunger, lady. I was a medical student at the time, so I don't know if he was screwing with me or not, but I had to maintain a non-judgmental attitude because my preceptor was right there. A guy, obviously male, in his late 50s came in and complained that he had never had a pap smear and that he was afraid of getting cervical cancer. A few things went off in my head. 1. Maybe he means prostate exam? 2. Maybe he wants a colonoscopy? 3. Maybe he actually does have female genitalia. 4. Maybe he's just severely and utterly confused and undereducated. My friend is a doc at the ER. She told me about a guy who came in and was blue all over his body. He was freaking out and trashing the place in pure panic. Turned out he had bought new blue bed sheets and they colored him blue. Dabba dee dabba die. I was a volunteer first aider for 10 years. I was on duty at a local judo competition. I was on edge as there was always at least one serious spinal injury. So I was walking around the mats, waiting for the call to rush in and help save someone. And this woman starts screaming and crying. I ran over as fast as I could, jumping over rows of chairs and ready to help. She was screaming because her baby's first tooth had come through and she didn't know what to do. She asked me to cut out the rest of the teeth so that she didn't have to deal with teething anymore. Nope. Should that person be procreating? Not a doctor, but I create accounts for the doctors and nurses to use in the ER. I work right next to the ambulance bay and I see all sorts of random shit. Some chief complaints I've witnessed. Also being hungry, also faking seizures, terrible attempts, also too sleepy, also a paper cut, also no complaint, also slow walking, obesity denial, also no money, also poop is too smelly, also lost tooth, also too much ear wax, also an entire family checking in for a possible cold, also a pimple, also too hot outside, also too cold outside, also too bright outside, also too dark outside, also too noisy outside, also evading police brutality, eventually arrested during visit, also forgot where she lived. Alleged concern but stupid at FCK. A guy came in with a FCK pitchfork impaled in his thigh. He and his friend was jousting on skateboards. Vaginal discharge. Did the pelvic exam. White clearish discharge. I looked at the sample under the microscope and see sperm swimming around. Asked her when last she had sex. She says last night. Which is when the symptoms started. Sigh. Not a doctor, but I was a nurse's assistant and a kitchen staff member came in and said help. I ate raw corn. Apparently the cook had convinced him that eating raw corn was poisonous or something. I had a good laugh about it. A woman came in for a baby check with her 6-month-old and she had what looked like chocolate milk in the baby's bottle. So he started explaining to her as kindly as he could that she shouldn't be giving her baby chocolate milk. At which point she interrupts him and says, "Asile, that isn't chocolate milk. It's coffee. He just loves it." Had a young man come into my ER, scribe, not doctor, one day complaining of dental pain. His wisdom teeth were coming in and turns out he had tried to cut them out with a steak knife. He was confused as to why this hadn't made his pain better. When I asked why he hadn't gone to his dentist to have them removed, he said something along the lines of, "I'm really scared of needles. Because a F-king steak knife is less imposing than a needle." Had someone come into my ER last night because they had a splinter. A small one. One that my 3-year-old would have taken out herself. Meanwhile, U/3's Thecharm got to deal with a 19-year-old patient who presented with lower abdominal pain. Worse than she had ever felt before. We ruled out pregnancy and ovarian cysts. CT scan showed she was literally full of shit. So constipated. It was a long night. Once a patient came into the ED because she'd tried to wax her underarms and the wax set. She couldn't get it off using hot water or soap. So thought sitting in an ED waiting room for 3 hours was a good idea. I didn't look after her, so cannot say for how my colleague got the wax off. Oil. Any kind of oil removes wax. We had an ambulance calling over the radio for a foreign body in left eye. We started mobilizing. Called the ophthalmologist on call. We're ready for shrapnel. A big ass tree branch. Something big. We get a woman with an eyelash in her inner eyelid. She got an ambulance and private ER for an eyelash. Our only consolation was thinking the big ass bill she probably got. ER nurse. We have a frequenter visitor every time he gets out of jail. The last week he's signed in for being cold. Having a nose itch after snorting cocaine. Needing to poop. It should be mentioned that he signs in. And refuses to see a doctor or have vitals taken. Or any care. It's also an ER in a college town. So every now and again we get a kid that comes by ambulance for anxiety after smoking a huge blunt for the first time. We get our influx of urgent care complaints. Once, a very large woman called an ambulance for chest pain. But really just needed help reaching the TV remote that got lodged in her fupa. A female patient comes to the ER, saying that she has an abscess. Turns out it was just a little pimple on the nose. Another patient comes to the ER during a very busy shift. I take her in. Ask her why she is consulting. Turns out her house burned out 2 weeks ago and her prescriptions burnt with the house. She didn't thought about getting an appointment with her primary care physician. Just came to the ER. So did you just send the second lady to her burned down house or? Not a doctor. But once I went to the doctor because I felt a bump at the center of the back of my head. Doctor told me that's where the spine connects to the skull. Whoops. My first thought was these stories shouldn't be told. We want people to feel comfortable and safe with approaching a doctor if they're worried about their health. Then I read these stories. Good God. People are dumb. Ran to the dermatologist because of a spot on my butt that I thought might be cancerous. Doc looked me in the eye and said Phil 330. That's a pimple. One evening in Emerg I had a woman come in because she had a low blood sugar. Yesterday. And she was totally fine now. She was having unexplained episodes of low blood sugars and was being very appropriately worked up by her family doctor as an outpatient. But she had come to the hospital for her husband's appointment and decided she would just drop into Emerg to see if we could do anything else for her episode that had completely resolved. Frustratingly, it was a very slow evening and she was seen within an hour. I had a patient present to the emergency room with a chief complaint of passing out. He reported that he would just pass out in the evening. I asked him if he ever fell and hurt himself. He said no. That he is in bed when it happens. I asked him how frequently this happens. He said every night. My dermatologist told me he had a patient freak out over horrible red bumps all over her one summer. They were mosquito bites. I once had a patient with a cancer diagnosis completely depressed about not being able to see their family anymore. I was confused because I had spoken with this individual's spouse and extended family who seemed supportive. There wasn't any indication of family problems, etc. It turns out that this individual thought genetic and family history had meant something similar to contagious, leading them to the conclusion that one should stay away from loved ones lest it be spread through the family. That was one clarification I was so happy to give. I'm an EMT and one of my patients went to the ER because they felt they had too much earwax in their ears and needed it removed. I'm a little late to the party here, so I'm not sure if anyone will see this. But anyway, I'm not in the medical field at all. But my wife is a nurse practitioner who regularly works with youth in the local juvenile detention facility where underage suspects criminals are sent to await trial and serve their sentences. One young lady in custody was pregnant and didn't know who the father of her expected child was. But she told my wife not to worry about it. Apparently she would be able to deduce the father's identity based on the child's accent after birth. Yup. Not a doctor. But I was a corpsman in the Navy. I had a Marine come in because he swallowed a rock. Why? I asked. Puzzled. Would you swallow a rock? I was hungry. F-king Marines. Man. I'm not a doctor. But I religiously go and see my doctor every summer about a mole I have on my back that could have been cancerous when I was younger due to overexposure to the sun which caused it to grow and go black. I go every summer because I'm not allowed to have it exposed to the sun. Yet they will not remove it. If it was so benign, why am I not allowed to tan my body? Worst excuse I got off a dermatologist was if we laser that off. Solution. Go to a plastic surgeon. They will happily remove that thing. It'll look like it never even happened. And they must submit it for cancer testing. A friend of mine working as a landscaper wound up in the ER after he reached into the moving blades of the massive mower to try to grab a stuck tuft of grass. Cut the tips off all three of his middle fingers in a line down to his middle finger first knuckle. Hilariously, it was his last day on the job after years of somehow escaping injury. Edit. I should add that he managed to do this while straining to reach around to the blades whilst holding in the clutch which kept them spinning. Not a doctor. Was an athletic trainer for a college football team at the time of this incident. Had an underage player who had been out on a Friday night and got wasted at a party. The cops showed up and everyone scattered. He ran and thought there was a cop chasing him. Witnesses say he was not being chased. He lost his shoes while running and then stepped on a hot manhole cover while walking home. He ended up with second-degree burns and an infection because he did nothing over the weekend to take care of it. The one that made me headache the hardest was a woman who complained about pain in her feet and wanted shots of painkillers and cortisone. She was knowingly wearing shoes 2 sizes too small because they looked prettier. Helping people damage themselves further is not part of the job description. She refused to get fitting shoes. I refused treatment. Not a happy customer. I'm not a doctor. But I once called 112, European version of 911, because I overdosed on space cake. Now, I live in the Netherlands. So it's legal to have up to 5 grams of weed. I had never been high before. And I thought 2 slices can't probably do too much harm. The thing was, the coffee shop that I bought it from put 1 gram of weed in their space cake instead of the usual 0.5 grams. The officer was like, dude, it's just space cake. You can't die from it. Just enjoy yourself. But I didn't know if I could trust anyone. Because everything just felt like it was happening in another dimension. It's very difficult to explain what that trip was like. It mainly felt like the time was repeating itself over and over. Like if I walked down the stairs. It felt like I walked down the stairs 5 or 6 times in a row. I had a couple who had been trying to conceive for over 2 years. I asked all the usual questions. How often do you have sex? Any previous pregnancy? etc, etc. Something seemed off to me during the consult. So I continued to ask questions. Finally I asked if he ejaculated while inserted into the vagina. Both parties looked confused. Turns out the couple was not having insertional sex at all. I had to awkwardly explain to them how insertional sex works. Diagrams were required. What were they doing?